Hi, Dr. Faber here. And one of the things I want to talk today about on Teaching Moments is the here and now fixes that are for short-term fixes, but not long-term health on that. And a lot of things that we do, even just shampooing and alone, is not something that works long-term. It may clean the dog, but if we're not replacing those oils, we're not replacing that sebum layer, or we're not replacing that hydration, it's not going to be long-term. And there's a lot of things that are being used out there, like dish soap, where we use it for skunks. It works pretty good. We could take away a lot of the skunk smell, but the problem is it compromises the skin, and so long term, we didn't leave that skin in a healthy place, and we're going to tend to have skin problems. Other things like vinegar rinses. Vinegar rinses work very well for closing the cuticle. The problem is vinegar is a pH of about 2.5 to 2.8. That's the same as stomach acid or lime juice, which is what we make ceviche out of. We cure meat in it. And so we're going to put it on the skin. So yes, we close the cuticle. Yes, it may be dried a little faster, but now we've compromised the pH of the skin and make it much more prone to skin problems. Now, in veterinary medicine, we do similar type things. We will use something like bleach solution to try to kill bacteria and fungus. Spray them down daily for 12 days. Well, the problem is the pH of bleach is a lot of times around 9. So yes, we killed the bacteria and fungus. Yes, it works really good for that, but then it compromised the skin, left it in the wrong pH. And that's where we get into a lot of problems with people using human shampoos, or, back in the day we used things like Head and Shoulders and Selsun Blue to take care of a lot of the dry, flaky skin. And yes, it worked on the short term, but it didn't on the long term. And you'll even see this with things like chlorhexidine that we use when we have dogs with infection. While you're using it, you get some very positive results on that, because it is a good antibacterial, antifungal. But the problem is it's also very dry and it's very stripping. And so what ends up happening is while you're using it, it works pretty good. But when you stop, everything comes back with a vengeance, because you never repaired the skin barrier. And that's the ultimate goal here, is to repair that skin barrier so that we don't get reoccurrence and we restore those natural defenses of the body. Hope that helps. We'll see you next week.